Good afternoon. My name is Alan Ablesohn. I'm a physician epidemiologist with Health Canada in the AQHI section, and I'm going to talk this afternoon about the AQHI itself, the Air Quality Health Index. I'm going to talk about what it is and how it's used. I'm going to start off with a case that might be appropriate to someone in public health or in a clinical practice. Mrs. Smith calls you about her 11-year-old daughter Judy, who has difficult to control asthma. She has heard on the news that the Air Quality Health Index, the AQHI, is forecast to be 7 tomorrow, and Judy is scheduled to compete in an all-day athletics event. She's concerned that Judy's asthma might be aggravated during the day outdoors by the air pollution, and she asks your advice as to whether Judy should attend. Questions arising from this are as follows. What does an AQHI of 7 mean? And what is your assessment of the risk to your client and advice to her mother? So I'll answer this in a couple of slides and then get on to the meat of the presentation. Firstly, what does an AQHI of 7 mean? The Air Quality Health Index is a measure of the risk to health from air pollution. The next slide is a picture from the web at airhealth.ca or another number of other locations. And this is what you see. At the top you see the extent of the AQHI, the scale from 1 to 10, with increasing risk, health risk from air pollution. So category of low health risk, moderate health risk, and high health risk. Very high, above 10, is quite rare. The AQHI provides the current reading, so the current risk to health in this case is 4, or moderate risk. And then it also provides in the lower section of the slide the predicted or forecast AQHI, the maximum for that day, Wednesday, the maximum for that night, and the maximum forecast for the next day. So Judy's mother has noticed that the maximum forecast for the next day is 7, which is high risk. Now, the AQHI advises people in an effort to help them reduce their exposure to air pollution and thus reduce the health effects of that exposure. The slide here shows the health messages, and it's divided up into 2 groups of people. On the right, the general population, the average person, and on the left, people who are at risk, and I'll describe this later in the talk. With Judy being an asthmatic, she is considered at risk, and with the Air Quality Health Index being 7 or high risk, you could see that she would be advised to reduce or reschedule any strenuous activities outdoors. So that in this case, Judy perhaps could go outdoors, but she should reduce her activities, or if possible, reschedule them. It's also important in this situation to make sure that Judy is on maximum medication, that is, she is well controlled on her medication, and that she has her reliever medication with her. I just wanted to follow this up with another case, which is a 55-year-old man with atrial fibrillation, and he calls. He's heard on the news that the AQHI is going to be 7, and being a triathlete, he wants to train tomorrow. He's concerned that his arrhythmia might be aggravated by the air pollution while training, and he asks your advice as to whether he should train tomorrow morning. In this situation, I brought this case forward to point out to the fact that although it's much more intuitive that air quality will affect respiratory health, in fact it affects cardiovascular health as well. And people with cardiovascular disease, including arrhythmias, as in this case, are an at-risk group. And so once again, this gentleman would be advised to either reduce his training schedule, or if possible reschedule it until the Air Quality Health Index is in a reading that might not be a threat to him. So let me get on to the full presentation. I'm going to talk about air pollution and health. I'm going to talk generally, and then I'm going to talk about the AQHI in more detail, and then talk about the application of the AQHI. So to start off about air quality and health, there is extensive evidence that showing that exposure to air pollution affects health in a negative way. Short-term exposure, that's exposure over a few hours or a day, is associated with exacerbation of pre-existing respiratory disease, so asthma or COPD, and, as I said before, exacerbation of pre-existing cardiovascular diseases, ischemia, cardiac failure, arrhythmia, and ischemic stroke. I'll just show you a few more details about this. This is a very interesting study published in the New England Journal of Medicine in December 2007. What the researchers did is they took a group of mild to moderate asthmatics and had them walk for 2 hours in 2 environments that were different, both in London and close together. One was on Oxford Street, the lower picture there, which is a busy street with bus and taxi traffic, and high levels of air pollution, especially diesel. The second location was in Hyde Park, which is not far away, but is a much cleaner environment. They measured and compared the 2 environments, and certainly Oxford Street had much higher levels of nitrogen dioxide, particulate matter, and carbon monoxide, so as would be expected with higher traffic. The asthmatics then exercised and measured their FEV1, which is a measure by blowing into a machine of the patency of the airways, so the amount of air that can be expelled in 1 second, which gives an indication of the width of the airway. And in asthma, you either get spasm of the airway or inflammation of the lining, which reduces the width, both of which reduce the width of the airway. You can see that in the asthmatics exercising in Oxford Street, in the black squares, the FEV1 dropped within an hour, so almost immediately there was an effect. And importantly, the effect remained next day, 24 hours later or 22 hours later, when they returned for follow-up. So this demonstrates the effect of exercise in relation to air pollution. The second piece of evidence I just wanted to show you is a study by Teresa To from Toronto looking at the Ontario situation. So she took the air pollution data, the Air Quality Heath Index, and correlated that with an asthma database which shows the number of people presenting to emergency rooms, outpatient clinics, and physician visits for asthma, or outpatient claims for asthma. And she showed a direct relationship between the two, so that each unit increase in the Air Quality Heath Index, as the risk to health goes up, or as the mixture of air pollution goes up, it was highly and significantly associated with an increase in asthma emergency room visits. So that's the short-term exposure. What about long-term exposure to air pollution? Now, the Air Quality Heath Index measures short-term exposure over a few hours or a day. Long-term exposure is a different issue, but it certainly is associated with health risks, associated with increased mortality. So in a more polluted environment, if you live in a more polluted environment, people die earlier. It's related to the development of atherosclerosis. And there's some emerging evidence that exposure of young children is related not just to the exacerbation of asthma, as we saw in the previous slide, but to the development of new onset asthma, so the development of asthma itself. And there's accumulating evidence that chronic exposure to air pollution in children reduces their lung function growth. And Gauderman and his group followed children up to the age of 18 and showed that their lung development was retarded. The next slide talks about the mechanism of the health effect of cardiovascular disease, and this is quite complex. How does air pollution exacerbate cardiovascular disease? In the long term, over the long term, it leads to the progression of the plaque, of the atherosclerotic plaque. In the short term, there is oxidative stress that causes inflammation, not just in the airways, but systemically in the circulation, that then can induce arrhythmias. That can also lead to endothelial dysfunction, the dysfunction of the lining of the blood vessels, and instability of atherosclerotic plaque. It can also lead to vasospasm, so spasm of the vessels and increased blood pressure, and also increased coagulability of the blood, leading to blockages or tendency to blockages in the cardiovascular system or related to stroke. So is this important? The next slide shows a study done by the Canadian Medical Association, published in 2008, called the National Illness Costs of Air Pollution. And it shows the burden of disease from exposure to air pollution. And we'll just look at the Canadian data. The other is Nova Scotia and New Brunswick. In fact, going into this program, you can get data for each province and also for each major city. So in Canada in general, this is the data for short-term exposure to air pollution as measured by the AQHI. Almost 2,700 acute premature deaths, 11,000 hospital admissions, and you can see 623,000 doctor visits, with a cost of $8 billion per year. The figure under acute premature deaths of 21,000 in brackets relates to not just short-term exposure to air pollution, but longer-term exposure to air pollution. And so that you can see that the longer-term exposure has a huge burden of illness. You might hear in the background some thunder. I'm recording in Toronto in April, and it's a rainy day with lightning and thunder. So forgive me if you hear some crashing and banging in the background. I'm going to now talk about what is the AQHI. So the AQHI was developed by both Environment Canada and Health Canada. This is very interesting in that the two departments cooperated. And the idea was to create a national simplified communications tool. Previously, many provinces and jurisdictions had the Air Quality Index, and it varied from province or jurisdiction to province. So the idea was to create a single national tool. And the idea of the tool is to empower individuals to take action to protect their health from air pollution. That's mostly what I'm talking about today. But also to create advocates for reducing pollution and to support active living, to support people exercising when the air quality is healthy and not injurious to their health. So the Air Quality Health Index measures pollutants at low concentration, such as are frequent in the big cities and across the country, not just in the cities, but across Canada. And it's a unique instrument in that it measures a mix of pollutants. So the mixture of pollutants that's called the chemical soup or the air pollution soup, that is the air that we breathe. Specifically, it measures nitrogen dioxide, ozone, and fine particulate matter. The AQHI was derived by looking at epidemiological associations between, similar to what Teresa Toe did, but over time looking at the spikes in air pollution, and you can see this in this next slide, any spike in air pollution, and then the corresponding elevation or spike in mortality in epidemiological studies. And so this study was run from 1981 to 2000. The data were derived for that, and a coefficient or a relationship between those two points was found, and so the AQHI is derived from that relationship for each pollutant over time. And the AQHI is really a sum of the risk from nitrogen dioxide, ozone, and particulate matter. The next slide gives you a better indication of this. It's a complex slide, but bear with me as we walk through it. It's a measure of the air pollution in Toronto during a regional smog episode in 2003. And on the left-hand side is a measure of the AQHI, on the right is the particulate concentration, and over the time period of a number of days. So we start with the AQHI, which is the bar graph, and you can see that rises in various forms. Then let's look at the nitrogen dioxide. This is the dotted line, and you can see that this rises and falls regularly. And in fact, it is rising every morning with the rush hour traffic. So nitrogen dioxide is a measure of fresh traffic, of traffic-related air pollution. You can see that it goes up every morning and then down in the afternoon. The AQHI goes up and down with it. The next reading is ozone, O3. This is derived from various other pollutants, but requires heat and sun to be formed. So it rises in the afternoon when there's more sun and more heat, and you can see that the peak then is opposite to the morning nitrogen dioxide peak, but the Air Quality Health Index responds to that peak as well. And the third pollutant in the mix of the AQHI is fine particulate matter. So these particles are very, very fine, 2.5 microns. Hair on your head is about 40 microns. These are tiny, they get into the lungs and deep into the lungs and cause inflammation in the body. And you can see that the PM 2.5 over time gradually builds up, and this is typical of a smog episode in Toronto, where you get a gradual build-up of particulate matter over time. What's important is the graph of each pollutant, but also the fact that the Air Quality Health Index is representing the various, the combination or the mixture of pollutants. And in this smog episode, the AQHI reaches 9, which is certainly high risk to health. So once again, I've included a slide of the website airhealth.ca, and we talked about this in the case earlier. Who is at risk? Well, we've already covered people with existing heart disease as the man with atrial fibrillation, and the asthmatic as people with lung disease. Diabetics are also at risk because they're more sensitive to inflammation. Young children because they're more exposed. The elderly because they're more frail. And then people who are active outdoors, people who are exercising, or people who are working outdoors. And people in the general population vary in their sensitivity to air pollution. There's an interesting body of research about pregnancy, that exposure to higher levels of air pollution over time, so not the short variations that the AQHI indicates, but longer-term exposure can affect the developing fetus, leading to a smaller fetus and an earlier delivery, so a shorter gestation. But these effects are smaller than the effects from smoking. Nevertheless, they are important. Once again, here's the slide showing the health messages related to air pollution that we talked about earlier. So where is the AQHI available? You can see that it's available across the country in most larger urban areas and many rural areas as well. So it's covering about 65% or 68% now of the Canadian population. Just a few indication of what category from AQHI you can expect. And I've chosen 2 Canadian cities. First, Calgary. And you can see on the top left table there that shows over time over the last 10 years, and in total the number of days on the AQHI risk category, number of days that would be low, moderate, high, or very high. In the total, you can see that the number of days in Calgary that are low is 35%, moderate would be 62%, and high risk would be 2%. Very high is very, very rare. And you can see that in Calgary, the mixture is that there are more days in winter that are a moderate risk and spring equally, and fewer days in summer that are poorer air pollution. So it's different from Toronto, which is the next example. Once again, you can see the frequency of the various risk categories. So 36% low, 59% moderate, and almost 5% high risk. No very high risk, but you can see that the greater number of days that are moderate risk and high risk are in the spring and summer in Toronto. So this depends on the sources of the pollution and the meteorology and geography of the two different cities. Let's talk about the application of the AQHI. And I've included some guidelines here. The first one is the Canadian Thoracic Society guidelines for asthma. And as stated there, that there's a section on environmental control where they state that exposure to air pollution has been associated with increased morbidity and mortality in individuals with asthma, as I indicated earlier. They suggest that efforts to reduce exposure to air pollution should continue, and that during periods of increased outdoor pollution, patients can minimize exposure by remaining indoors or reducing exercise outdoors. So this is supportive of what the AQHI does. We recommend reducing outdoor exercise, and if there are healthy indoor environments, that is something to recommend as well. But it's important to define if that environment is a healthy indoor environment, and frequently when the air pollution is high outdoors, there will be elevated pollution indoors as well, unless the air conditioning system is good and the air well filtered and the building tight. What about heart disease? Well, the American Heart Association, in their scientific statement published in Circulation in 2010, states that all patients with cardiovascular disease should be educated about the cardiovascular risks posed by air pollution, and recommendations for reducing exposure and limiting activity should be provided, which is exactly what the Air Quality Health Index does. The Heart and Stroke Society of Canada also recommends this. Now, this is an interesting study looking at the role of healthcare professionals in relation to counseling their patients. And what Wen and colleagues did was look at the advice to asthmatics and the number of asthmatics who changed their outdoor activity in relation to media alerts on air quality. So this was a US study, but essentially we're changing their behavior in relation to what the media reported about air quality. If they had not received professional advice, 23% of the people studied changed their activity. And these were mild to moderate asthmatics. If they had received professional advice, 57% of people responded and changed their behavior and protected themselves from air pollution. So you can see that fairly simple intervention by a healthcare professional can lead to a large and significant change in behavior of their patients. And so we would encourage you, if you're health professionals in any way to, or parents, to pay attention to poor air pollution, to poor air quality by tuning into the Air Quality Health Index. The next slide summarizes what we suggest. What can you do in counseling asthmatic and cardiac patients? Number one is advise them to tune into the AQHI. And there are a number of ways that the next slide will show you how you do that. Number two, determine your risk group. Are you an at-risk person or an average general population? Number three is self-calibration. This is trying to get a sense of your own response to various risk groups or the various numbers in the Air Quality Health Index. And I'll use myself as an example. I'm lucky enough to be able to ride my bicycle to work on back streets, about a 20-25 minute ride that includes a hill. I have found that when the Air Quality Health Index reaches 6, and if I ride, I actually start to feel wheezy, and I'm not an asthmatic, and a bit tight in my chest. And it doesn't feel good, and it remains for a few hours afterwards. And so I have self-calibrated, and when the Air Quality Health Index is fine, I'm fine to ride. When it's 6, I shouldn't. And it's people are advised to self-calibrate. Now, the health effects from air pollution can happen immediately, as in my wheezing in relation to a 15-minute ride, but they can also be delayed 24 to 36 hours. So Might be that I exercise today and find myself wheezy tomorrow. People vary in this. The advice then is to reduce or reschedule strenuous activities on a day when you might be sensitive to that level of AQHI, of risk in the AQHI. And also it's important to avoid traffic. Traffic independent of the AQHI, traffic air pollution is hazardous. A couple of other things. Number one is disease control is important. So the better an asthmatic is controlled with their controller medication, the less responsive they likely are to the injurious effect of air pollution. This is also true for people with cardiac failure and arrhythmia, and atherosclerotic heart or ischemic disease. And the final thing is, as I indicated earlier, is to be aware that indoor air varies in quality itself, and to pay attention to the quality of your indoor air. So, where can you find the AQHI? It is broadcast now broadly on TV by the Weather Network, also in print. It's available on the internet at airhealth.ca, at Environment Canada's Weather Office site, and at the Weather Network. Also on provincial websites across the country that carry it. And there are a number of technologies that make it easier. There's a widget and phone app that will, two apps that will give you access to the AQHI coming into your smartphone or your desktop or your laptop daily as requested. So I wanted to end up with just mentioning a few resources. At airhealth.ca, there are a number of outreach products that are available. Some more complex than others, some appropriate to various populations. People have liked the tear-off sheets, which just a one-pager that can be torn off and given to patients or clients. There's a wheel that is quite useful to look at, and these are available through the website. And finally, just some other resources, the website airhealth.ca. Secondly, there is an online course through the University of British Columbia that describes the health effects of air pollution and the role of the AQHI. It's an accredited course for health professionals. You can take it by accessing this website. And thirdly, I wanted to just point out a article that I wrote with the epidemiologist who is responsible for the development of the AQHI, Dave Steeb. It's an article that is quite written in an accessible format with some resources and might be of help to you. So I thank you very much for your attention, and I hope you've learned something about the AQHI.